Hi there everybody, it's Dr. Daniel Chanishev from Green Square Health again. I want to just update you all on the recent changes as it reflects into Green Square Health, and then my general advice for us as individuals in our community and what to do. As you're aware, it's been a little bit of a difficult time with changes happening so frequently and information not being so readily available. Any medical information that's coming out has been a little bit haphazard and not so consistent. But there have been some very good resources showing us who should be tested, when they should be tested, and what people should be doing. However, I do feel that some of the advice coming out right now is a little bit retroactive, a little bit reactive, sorry, and would like to make sure as a community that we're taking all steps possible to reduce the spread of any infection at the moment. You might have heard the terms flattening the curve, which is to say that the longer that we can delay any infections that are now spreading from person to person in the community, the more prolonged our peak will be, which is actually a good thing. We don't want everyone getting sick at the same time. So if you can avoid social contact at all, that is one of the best things we can do, and I'm going to talk about that at the end. First of all, the steps that we're taking at Green Square Health to protect our patients and to protect our staff are as follows. If you were to make an appointment by calling into the clinic, we're going to ask you first and foremost, do you have any symptoms of a cold, flu, cough, runny nose, sore throat, or fever? Or are you worried that you may have been in contact with someone with COVID-19? Or is there anyone in your household or close contacts that satisfy that criteria? If that is a yes, we ask if your symptoms are severe. Are you feeling short of breath now, short of breath when you're moving, or are you having a cough that's actually really difficult to shake? If that's a yes, we encourage you to call straight to the emergency department and call ahead first. If it's a no, we're going to offer you a telephone consultation. Now, this is like a regular consultation, just done over the telephone. You get given an appointment time, your doctor will call you, they'll take a history as per normal, and they'll try to help you out any way they can. If the advice in the end of the day is to stay home, rest and hydrate, that's what we'll do. If you need a medical certificate, we'll email that. Usually email is a poor use of, it's a poor way to transmit documents because it's not as secure as what we usually like to do, which is person to person. But in this time, I think we have to forego that if people are willing to accept the risk that the email might be accessed by someone else. These are things like sick certificates and blood test request forms and referrals, so nothing too dramatic, but please do make sure that you have good secure passwords on your email for us to be able to do this. If you've called up and you're not concerned about coronavirus and you don't have any symptoms, we then ask if you've been overseas in the last 2 weeks. As you're aware, from today, from tomorrow, Monday the 16th of March, anyone who's been overseas in the last 2 weeks will have to self-isolate when they get back to Australia. So if you have been overseas, we'll offer you a telephone consultation. If you have not been overseas and you do not have any symptoms, we'll still offer you a telephone consultation, but you have the option of coming into the clinic if you prefer, because we'll still be working here. Once you get to the front door, the receptionists are going to ask you again if you have any cold or flu symptoms, runny nose, sore throat, fever. Because things can change between the time you make your appointment and the time you present. And as I've noticed, people can often cough, sniffle, sneeze without even realizing they're doing it themselves. So if our receptionists do pick that up, they'll offer you a telephone consultation. If you're already here, we can either offer you to go back to your car and do the telephone consultation, or if that's not an option for you at all, our receptionists will give you a mask, they'll wear a mask, they'll put on gloves, and they'll bring you into our isolation room. So if you do present to the clinic and you do have any symptoms at all, then the receptionist will ask you to return to your car and keep your phone on, and the doctor will do a telephone consultation. If this is not possible because you don't have a car and you don't want to do a consultation from off the street, the receptionist will also give you a mask, will bring you into the clinic, and will bring you into our isolation room. Now, this isolation room is cleaned between every single use. It's been stripped of all its equipment except for an examination bed. From there, we ask you to keep your mobile phone on, and your doctor will be able to call you from their room, and if it's necessary to examine you, they'll go in wearing personal protective equipment. Once that room is finished being used, the nurse goes in and cleans all surfaces using quaternary ammonium products and following all the New South Wales Health and the Australian Department of Health guidelines. If you are well at the end, you've got no symptoms whatsoever, and you haven't had any travel history, we'll bring you to our individual rooms. There is marking tapes on the ground to indicate a distance of 1.5 meters, which is the social isolation distance. So please respect those lines and sit behind them. We're not trying to make anyone feel bad for being here. We just want to really make sure that our staff are well so they can continue to look after patients going forward as winter approaches. If you do not want a telephone consultation, we can take your details down and the nurse can ask you some questions and figure out what's the best thing to do at the moment. There may come a time in the next few weeks when we have to do 100% telephone consultation. So we're going to try to remain seeing patients that are necessary as long as possible. Elective things such as excision of moles that are not dangerous or cancerous, excision of cysts, we're going to ask you to delay them if possible. Anything that's sort of a cosmetic procedure, we've stopped doing all cosmetic procedures for the time being. But for things that are necessary like iron infusions, cervical screening, these are really important things to look after your health in general, and we should still be able to continue these until we're not able to do so anymore. All this information may change at any given time, so please subscribe to our Facebook page, and I'm going to keep updating that as frequently as we have to. In regards to social distancing, this is something that's been thrown around a lot by the medical community, and it's something I wholeheartedly agree with. If you have the capacity to work from home, if you can remotely log in and do things, encourage your employer to put this into motion. People who are programmers, people who are working in office environments where there's nothing physically that needs to be done, it's all based on a computer. This is what technology is for, so make sure that happens. For people that have to travel for work internationally or domestically, put it off. It's not worth the risk at the moment. International travel definitely is too risky, but even domestic travel, as a lot of flights, when they land, have domestic connections. As we've seen, the processes are not infallible to make sure that everybody is screened properly. And if there are suspect cases, tracking back is really reacting and not being very proactive. So if you have any upcoming domestic holidays where you have to fly, put that off as well. In terms of going out and about, everyone's got differing levels of risk. What I'm doing is using the stock that I have at home, things that I already have in my fridge, and trying not to go out to eat. Delivery services such as Deliveroo and Uber Eats have made contactless options where people will come and drop it off at your front door. You're not seeing them face to face. So I think these are good steps and measures that people are taking at present. In regards to school and childcare centres, a lot of the Northern European countries as well as Ireland have already put this into place, and I think it's a matter of time that Australia will as well. So please start preparing for the possibility that you'll have to care for your children at home. If possible, don't take them to your parents' house if they're at medical risk at all. Usually we have grandparents look after children. It's a very common thing. See if you can avoid that. I'm very proud of our community. There's a Facebook group in our neighborhood here where people share ideas and share information. And people have stepped up really and put themselves forward for giving people out of their own pockets, hand sanitizers, toilet paper, sharing things like food if other people are unable to get their hands on some. I've seen people volunteer to deliver food to the elderly and to people that can't leave their homes, and I'm really touched by this. We are the most dense neighborhood in Australia, and we're set to become even more densely populated, and yet the strength of the community here is quite amazing. I think that every community is going to be like this. I really do hope that we look after each other in this time. To any airlines or any hotels that may be listening to this, I encourage you to put your best foot forward and offer people fee-free cancellations at the moment. They're trying to keep your staff and other people overseas safe by not traveling. I think if hotels are giving fee-free refunds, or at the very least credit that can be used at any time later on, people will repay it a million times over with travel and extended stays after a year like this. So I encourage the accommodation and tourism industry to do this. I know it's difficult, particularly after the bushfires have affected everybody. And if people can buy vouchers, knowing they can use it later on, do that. But at present, don't travel. And I hope that the airline industry and the hotel industries make it a lot easier for people to be able to make that decision and stay back. Okay. To the Immigration Department of Australia, this is something that a lot of people haven't thought about, but as you're aware, there's a lot of people that work in Australia on very temporary visas. And a lot of these people are medical staff and nurses. They might be on skilled visas, they might be on spousal visas, they may be on temporary working holiday visas. A lot of these people's visas are going to expire over the next few months just because of a matter of timing. And a lot of people then have to leave, and these people are often in line for permanent residency applications anyway and have very high points. I encourage the Immigration Department to review this process immediately and put a pause on people exiting the country. It's usually a bureaucratic process that someone has to leave Australia to reapply to come back, and they're often approved anyway, particularly if they're nurses or doctors. It really is a rubber stamp process. So I encourage the Immigration Department to have some leniency here, and I think it's really short-sighted to continue with this because people are trying to stay here to work in our healthcare system. And I know some stories of this personally. I've been talking to some medical staff and nursing staff who are in this situation, and they're having to travel overseas where there's lockdowns to go home just to be able to wait for their permanent residency to be approved. And at that stage, they're not going to be able to fly back. So we're really shooting ourselves in the foot here by doing this. So, please. Thank you everybody for listening to the end of this talk. I know it can get a bit lengthy, and I know I've been posting a lot of information, but I'm trying to keep it as succinct and up to date as possible. I'm going to post all the flowcharts of what we're doing as a process here online so other medical centers can see it and share it. Hopefully I get to reach out and get in touch with all the medical centers around me as well, and we can have a bit of a united effort in how we're going to tackle this thing together. So thank you very much for listening again. Dr. Daniel Chanushev, and please stay safe.